It was there at the beginning. Now, when you look back, I think essentially there were vulnerable elderly, but who suffered, especially people in nursing homes. There were a lot of deaths there. But there's so many other components to this. So one is, did we institute the correct treatments? A lot of people were killed because they weren't managed properly in ITU, in terms of putting people, intubating them, putting on respirators when they didn't need it. And that in itself has a risk. Some of the wrong treatments were given. There were other treatments now that we look back that probably would have been helpful. Things like ivermectin, which I know has been a bit controversial, but it's very safer than paracetamol, right? So first do no harm, okay? But it may have done some good, and a lot of people and doctors around the world that used it in several thousand. There's a doctor in South Africa that used it in 14,000 patients, including many elderly. Not a single one died from COVID, and this is early on. So all these things that we missed a lifestyle intervention. So all those things are there. But by the time you get to the end of 2020, the beginning of 2021, there are so many things that happen, Steve, that you have to think about before you introduce a vaccine. One is, what is the state of the virus right now? And it had already mutated to some degree and become less lethal. There is natural immunity, which we know is very powerful, right? But the issue with the vaccine is, and certainly it was probably there from the beginning, we know that when one looks at the original trials, there was and this is what the drug companies have done for a long period of time, they will mislead people using statistics about the benefits. So use something called relative risk reduction. So let me just explain this, because you can apply this to statins as well. Is they presented the benefit as a 95% protection against infection. Remember that figure, 95%, right? And it was what we call relative risk reduction. So if you've got, for example, two groups in a trial, say 100 in one trial, in one group and 100 in another, and let's give you an example of statins, and you're following them up over 5 years to look at a drug to see if it benefits them in preventing having a heart attack.